Today I'll be speaking to you about people with chronic alcohol abuse, which is also referred to as alcohol dependency, alcoholism, excessive alcohol consumption, heavy drinking, alcohol use disorder, and alcohol addiction. Abuse can be mild, moderate, or severe and can progress over a short or long period of time. People who struggle with chronic alcohol abuse come from all different walks of life. Alcohol abuse affects all ages, incomes, races, religions, sexes, education levels, socioeconomic statuses, and cultures, with men typically drinking more than women. Worldwide, drinking is considered an important part of social life, but excessive drinking is typically looked down upon. Today in the U.S., nearly 14 million adults, or every 1 in 13 adults, abuse alcohol or have an alcoholism problem. In addition, several million more partake in risky alcohol consumption that could potentially lead to abuse among adults and underage drinkers. Utah has the lowest consumption of alcohol in the United States. This is most likely attributed to the demographic of people living in the state and to the strict alcohol regulations enforced by their state government. Although Utah has the lowest consumption of alcohol, many people living in Utah continue to battle alcohol addiction. Utah is comprised of a large religious population, the Church of Jesus Christ of Latter-day Saints. They choose to abstain from harmful substances like drugs and alcohol. Over half of the state's population identifies as Mormon, and the presence of the LDS Church has influenced how we treat people with chronic alcohol abuse as well as the drinking laws in Utah. The legal drinking age in Utah is 21, which is standard across all of the states. Utah has a handful of unique drinking laws and has the lowest legal limit for blood alcohol content in the United States. It is 0.05 in Utah compared to the national legal limit of 0.08. Compared to drugs, alcohol is considered a depressant rather than a stimulant. Alcohol is typically legal compared to many drugs that are illegal in the U.S. The social stigma attached to addiction tends to be stronger when the substance one is addicted to is illegal. However, alcohol addiction is just as serious. So why are alcoholics considered to be a vulnerable population? Chronic alcohol abuse in the United States is harmful to the health of those who drink excessively. Alcohol is among the leading causes of preventable death worldwide, with 3 million deaths per year attributable to alcohol. Large intake of alcohol can affect speech, muscle coordination, brain function, and can possibly lead to coma or death. There are many health risks relating to long-term alcohol abuse, which include stroke, hypertension, heart disease, liver disease, cancer, and a weakened immune system. The health and safety of those who abuse alcohol decreases as they continue to put themselves and their loved ones in dangerous situations. Alcohol is a harmful drug that exposes incoherent people to severe hazards that could lead to their possible death. There are many negative effects of alcohol abuse, including susceptibility to alcohol-related harm. Heavy drinkers are more susceptible to violence, motor vehicle accidents, and sexual abuse when under the influence. The population of heavy drinkers is vulnerable due to their increased exposure to physical and emotional danger. Alcoholics are also vulnerable to social issues relating to their mental health, their memory, and their relationships with family, friends, and coworkers. Many hospital visits involve intoxicated people. Alcohol contributes to about 18.5% of emergency department visits, and an estimated of 95,000 people die from alcohol-related causes annually. ER visits are expensive. A study done in 2010 estimated that excess drinking cost over $249 billion a year. One of the hardest parts of recovering from alcohol addiction is realizing that it is a serious problem. Admitting to alcoholism is the very first step of the healing process. Healing is a complex process that takes time and requires the support of your healthcare providers and loved ones. Those who have a strong support system in place tend to recover faster and decrease the likelihood of a relapse. Treatment is a long-term and multifaceted approach that aims to disrupt the cycle of relapse and abstinence. It's important to realize that temptation never goes away, and it can be difficult to let go of old habits, especially during the withdrawal phase. It is important for the individual and healthcare provider to decide which route of care is most suitable, whether that be inpatient or outpatient care, based on the level of dependency on alcohol. Typically, inpatient recovery programs require patients to check themselves into a controlled environment to overcome their addictions, while outpatient rehabs are part-time programs that allow recovering patients to return to daily life. Medication, therapy, and abstinence are key components to the healing process of an individual. It is important to consider the possibility of relapse, but remember, only a small percentage of relapses require medical treatment for detoxification. Some individuals may be able to reduce their drinking spontaneously. Recovering from alcoholism is a lifelong pursuit. In the future, I hope to work in healthcare, treating people for mental illness and substance abuse disorders. My goal is to inform others and to learn more about treatment and how I can help those fighting addiction. There are many resources available to those in need of help. If you or a loved one is struggling with addiction, be sure to have compassion and to be understanding. Knowledge is power. Educate yourself about many different types of addiction and treatment to allow for continual recovery